Greetings from Sevalaya. Today, India has been going through a very bad patch. I do not know we had any day like this in the history before. There are a lot of people who are dying, people who are not well, affected by the COVID-19 or the coronavirus. All the hospitals, including the smallest hospital in the smallest town, it's all full. So the problem is you can get sick, but very difficult to get treatment. That is the situation. Everywhere, hospitals are full. People are queuing up in front of hospitals. Oxygen, medicines, all areas there is an issue. There is a problem. All the governments, all the state governments, the central government, they're all doing their best. They're all trying to address the problem. They're all working on war footing to come out of this situation. But just the number of people, the population in India, and the speed at which the virus is spreading is really creating havoc. We should salute all the government department people, the frontline workers, doctors, nurses, the cleaning people, all the people who are engaged in all the running of all the hospitals. They're all doing a great job night and day. They are sacrificing their life and they're working. But I think the size of the problem is because of the size of the population, and it's really proving to be very difficult to manage the situation. To get all this, whatever is required, the medicines or the vaccines or the oxygen or hospital beds, for everything, funding is required. People are required to arrange all this. So Sevalaya is playing a very small role in the looking at the enormity of problem. What we have been doing is something really small, but still, as the squirrel in the Ramayana, Sevalaya is trying to do its bit in addressing these problems. Sevalaya, as an organization, it has got 33 years of experience. It has been working for the welfare of underprivileged children, destitute old people, destitute animals, skill development, job creation in villages, skill development, various activities related to health. Many activities Sevalaya has been doing in 13 locations now, spread over in Tamil Nadu and Puducherry. These are the two states in which Sevalaya has been operating. Also, right from the tsunami time, that is in 2004 onwards, Sevalaya has been getting into relief and rehabilitation activities, to some extent in the rescue activity also during floods. But majority of our action is in relief and rehabilitation type of activities. So every time there has been a problem, whether it be tsunami or the floods or the earthquake, floods in Chennai, floods in Kadalur, floods in Puducherry, floods in Kerala, everywhere Sevalaya has jumped into action, and then within a couple of days, our volunteers, our staff members, they were there trying to help the people who have lost their livelihood, who have lost their houses, people lost their jobs. Different type of problems were there for people, and Sevalaya was able to address all this in a very small way. Compared to the problems, what we have done is negligible, but we did something. We did not keep quiet in any of the situation where there was problem. Now, during the Corona wave 1, that is from last March onwards, Sevalaya has been continuously engaged. That time we had lengthy lockdowns. That situation has not yet happened in wave 2. Currently, Karnataka, Kerala, Tamil Nadu, Maharashtra, Delhi, these states have been maybe last 2-3 weeks there is a lockdown. This may continue. If it continues, then it may become like the wave one problem. Wave one, we had much longer lockdowns, and because of that, the daily wage earners, every day they have to go and work, and that evening they will get paid. Those kind of workers, they had nothing to earn. That was the problem. So many people, they are already poor. Now they are deprived of any earning. So there is no food. So food became the problem in wave one. We had a lot of migrant laborers who wanted to go back because all the factories, everything is shut down. They don't know, they have no way to go back. There is no transport. They have no place to stay. They don't have any food. So such migrant laborers, destitute, the people who lost their jobs. For many people, even the middle class people, the salaries were cut, and they were not able to make both ends meet. So we found a lot of problems, in that area where we had to run community kitchens in many villages. We were preparing breakfast, lunch, dinner, everything, and then we were supplying hot food to people where it was required. And in many places, we supplied the provisions required for them to cook so that they can cook and manage on their own. And many of the hospitals, they wanted the PPE kits, so that we ensure safety for doctors and nurses and all the frontline workers. So a lot of PPE kits were donated to various hospitals, masks, gloves, all this was given, ventilators, medical equipments, hospitals needed it. So Sevalaya was trying to raise funds and give all this during the wave one. We thought, we have come out of it. Things were better. It was improving. The daily count was coming drastically down. Suddenly, out of nowhere, the wave two has hit, and it has simply galloped. And then the numbers are really 2 times, 3 times, 4 times more than what it was in wave one. Yesterday, Tamil Nadu has crossed around 33,000. In wave one, the maximum was 6,800. Today, every day, we are getting more than 6,000 cases just in Chennai, in one city itself. Whereas in one entire state, we had the maximum number as 6,800. Now, the numbers are different. The death counts are going up. And now we could see, even in crematoriums, there is no place. Forget hospitals. You want to bury your near and dear ones, there is no place. So that is the situation now, really grave. And as usual, Sevalaya has got into the act, and we have been educating the villagers. Now the trend, what we see is there is more spread in the rural areas, the villages. It was not so in wave one. In wave one, only the densely populated cities were affected. Now it is not just the city. City is also affected. Apart from the cities, all the towns, all the villages, everywhere, corona has spread. That is why the numbers are so big. So the villagers, the awareness level is very low. Access to medical facility is low. So in such areas, Sevalaya centers are there. We select those areas and go and work there because we wanted to serve only the underprivileged and people who do not have any other facility to look for. So in those areas only we are serving. So we have an advantage. We have people there. We have our staff members there. So we conduct a lot of awareness programs, trying to tell the villagers what they should do, what are the do's and don'ts, to get out of this corona problem. And also we are giving it free. The masks, the sanitizers, hand wash soaps. All these are luxury for those kind of people. They wash their hands just with water. Using soap and all is a luxury. They don't have money for that. So we have been supplying all that for the villagers. That activity we have taken up, awareness plus safety kits distribution. We are doing that, and also in the hospitals, now there is a huge requirement for oxygen concentrators and oxygen cylinders. So Sevalaya is trying to collect funds and then buy all these things and give it to various government hospitals free of cost, so that they can use it for the patients. We are also trying to create ICU beds in some of the government hospitals, big government hospitals, in many big cities within Tamil Nadu and Puducherry. We have been trying to do these things. Also, food is also becoming a problem slowly. So we have to look at that area also where we can start supplying provisions and vegetables and all for people who are out of job at this stage. So I appeal to all of you, that there is huge donations are required at this point in time, much more than what you have been donating in the past. Now the problem is at a different scale. If you have to handle this, then a lot of funding is required. Of course, state governments, central government, they're also appealing for donations. NGOs like us, they're also appealing. So wherever you are comfortable, I'm not saying that just donate to only to Sevalaya. Okay. So please, spare some of your savings, some of your contribution is required at this point in time. It's very critical. Your money, every paisa, every cent you give is going to save lives at this point in time. So let us all contribute. Let us all contribute, and then let us all try to see how we can change the situation. Just for your information, Sevalaya has completed all the requirements of the government. Government has changed the FCRA rules recently. Sevalaya has complied with every single point where the FCRA new regulations are there. The government wanted us, all the NGOs who are receiving funds from abroad, to have the FCRA account only in State Bank of India, New Delhi branch. We have done that. Sevalaya has a operative account in State Bank of India, New Delhi. All the NGOs, we had to be registered with the central government to accept foreign funds, to accept CSR funds, various corporates. So that registration we have gone through, and then we have a registered number. So we are authorized by the government of India to receive funds from abroad, to receive funds from various corporates as CSR funds. And we have an experience of 33 years of doing social work, and last 16, 17 years in managing calamity situation like this. So that experience is also there. With all that, I appeal to each one of you that let us all join our hands together, and then let us see that we should not be losing so many lives. Right? It is our duty to save lives. Thank you very much.